Good afternoon, everyone, and a very warm welcome to Health Insights Live. For those joining us for the first time, we've created this series to discuss healthcare topics and challenges facing businesses across the UK. As a result of the pandemic, the definition of wellbeing is shifting, and our role is to help you and your clients adapt to our new reality by exploring the prevalent and also hidden healthcare issues impacting the workforce of today and tomorrow. This afternoon, we'll be addressing the impact of the pandemic on cancer. Healthcare systems have been placed under huge strain in the fight against COVID-19. And according to the World Healthcare Organization, the pandemic has disrupted services for non-transmissible diseases like cancer in 122 out of 163 countries. As I'm sure you've all seen in the headlines, disruption to cancer services inevitably leads to delays in diagnosis and treatment, impacting the chance of survival for hundreds of thousands of cancer patients. First and foremost, there is a profound human cost of cancer in every country of the world. It's a leading cause of death and an important barrier to increasing life expectancy. And unfortunately, I expect everyone here today will have been personally affected by cancer, whether it be a loved one, a colleague, friend, or even yourself. In addition to the human toll, there's also a significant financial burden, including the direct costs of treatment, care, and rehabilitation. And an estimated 1 in 3 people living with cancer in the UK are of working age, creating indirect costs linked to the loss of economic output as a result of missed work. The backlog in many healthcare systems will persist for months and perhaps years, and innovative approaches will be essential for services to return to some level of normality. Before the pandemic, Britain was already underachieving in terms of cancer survival, and this is now likely to get worse. We've been talking about this growing crisis for some time, and now the latest figures confirm there have been steep drops in the number of NHS cancer referrals over the past year. Cancers are not being spotted quickly enough, and unless urgent action is taken, there is now a very real potential that survival rates will start to go backwards for the first time in decades. The cancer crisis is complex, but we know that early detection is key to saving lives. And as responsible businesses, we all have a vital role to play in tackling cancer. Together, we can raise awareness of the importance of early diagnosis, regular screening, and preventative care to support and protect our workforces. So for today's session, our 4 experts will share different insights and perspectives on the challenge ahead of us. We'll also be following up after this event, as ever, with resources to help you raise awareness and support your people with cancer. Plus, in June, we'll launch our new Bupa Academy for Health and Wellbeing, a programme to bring together businesses and the broker community alongside Bupa experts to make a difference to workplace health. We'll be kicking off the Academy with a deep dive on cancer. For our agenda today, you'll hear from each speaker for around 10 minutes, and we'll then ask the panel, as ever, to hear your questions. So I'm delighted today to be joined by Sara Bainbridge, Head of Policy at Macmillan Cancer Support. Sara brings a wealth of experience holding previous roles such as Head of Policy and Delivery at NHS Clinical Commissioners. Sara spent several years in Cancer Research UK's policy team and was part of the Secretariat who developed the 2015 Cancer Strategy for England. She has an MSc in Public Health from the London School of Hygiene and Tropical Medicine. As ever, we're joined by James Sherwood, Director of Healthcare Management, who, as usual, will share a quick update on current hospital capacity and then follow up with an impact of what we're seeing at Bupa from a perspective of cancer care during the pandemic and how we're responding. We're joined by Jennie Law, Corporate Lead Clinician, UK Insurance. Jennie is a registered general nurse and has been at Bupa for 21 years, providing clinical support to our corporate team and their clients. Jennie will share considerations for how we support our own people with cancer. And Dr. Luke James, as ever, is here, our Medical Director, who will share his reflections on how we can manage the cancer crisis going forward, and also what innovations we can expect in screening, diagnosis, and prognosis. So without further ado, let's get started. Sara, over to you.
Thank you so much, Mark, and thanks everyone for being here. Really pleased to be able to join you this afternoon to talk about this incredibly important topic. And thanks for that intro. As Mark said, my name's Sara. I work for Macmillan Cancer Support. And for anyone who thinks of Macmillan and has been familiar with our coffee mornings or our fundraising efforts, our mission at Macmillan is to support everyone with cancer in the UK get their needs met. So we're here to support people with the physical, emotional and financial side of cancer. And it's a pleasure to be here talking about this incredibly important topic. So my role at Macmillan Cancer Support is all about affecting change and making sure that decision makers across the country are really clear on what needs to be done to improve the lives of people living with cancer. And unfortunately, this last year has thrown a huge amount of disruption into cancer services up and down the country. And that's the case for lots of different health conditions, I know, but today I'm here to just talk about what the impact on cancer care has been. So using my first slide, we've got a picture telling 1,000 words, or in this case, just one graph. What this shows is, I think, a really clear example of just how significant the pandemic and its impact on cancer services has been. So lots of you might have, as Mark alluded to, some interaction or experience of cancer care, whether that's getting checked out for something yourself or because a loved one has been through a cancer experience. But what's common for everyone is that there will need to be a way in which that person gets their diagnosis. Now, cancer diagnosis can happen in lots of different ways. We know that people get screened for some cancer types, which is when they get checked out when they don't have any symptoms at all. That could be a mammogram, a cervical smear, the bowel screening kits, which comes through the post. But the most common way people get diagnosed with cancer is actually through a referral from their GP, and we call that the 2-week wait. So this graph shows what happens to the 2-week wait. So that's those urgent GP referrals in the period of the pandemic. So sort of this time last year and over the last few months. So I wanted to talk through this graph with you just because I think it shows what the challenge is now, really. That green line at the top is essentially what you'd normally expect to see in terms of the number of people in England getting their 2-week wait referrals. So those are people who've gone to their GP, said, I'm a bit worried about this lump I found, or my tummy troubles haven't gone away, or I've been coughing for 3 weeks. And you tend to see a sort of general line which doesn't vary that much. It maybe changes a little bit around Christmas time just because people put off going to see their doctor. But what happened in April last year is the pandemic was probably at its height in terms of encouraging, or the government was definitely encouraging people to stay at home, protect the NHS and save lives. And of course, that was the right thing to do. But I think one of the unintended consequences is that people really did stay home and didn't bother their GP with a cancer symptom. So that real dip that you can see in the blue line shows just how few people contacted their doctor and then got an urgent referral to get their cancer checked out. And over the last year, that's really added up. And we think that the cumulative total of people who haven't been referred for that 2-week wait is over 350,000 people. Now, not all of those people, in fact, most of those people don't have cancer, but we know that some of them do. So it's a bit like finding the needle in the haystack. We need to make sure that people are coming forward, seeing their GP and getting checked out for those cancer symptoms, because we need to make sure we find the 7% of people who normally get referred that way and do have cancer and need to get their diagnosis and treatment quickly. So my next slide shows the impact of this. What we've seen, as I said, is this kind of cumulative drop in people getting diagnosed. At the moment, we think that in the last year, around 38,500 people haven't started their cancer treatment in England, who you'd expect to see starting their treatment in normal times. And as I say, cancer is a time-sensitive disease. And often, as we've heard from Mark, early diagnosis really, really makes an impact. So if you just take a sort of snapshot in time, and what we'd normally see is people getting diagnosed, and some of them will be diagnosed at an early stage when their cancer is local, it's easier to treat, it could be taken out with an operation. Now, if those people haven't been diagnosed in the last year and perhaps were staying at home, not wanting to bother their GP, it might mean that they get diagnosed at a later stage, and that then leads to an impact in having fewer treatment options and potentially some of those people less likely to survive their cancer. So we're really, really mindful, and at Macmillan we've been campaigning on this for the last few months. We have to make sure people come forward, but we also have to make sure that the NHS is really equipped and set up and ready so that when those people do arrive at their front door and are saying, I need a test for something that I'm worried about, that there's enough capacity to make sure those people get tested and then get treated really quickly. Because we really need to make sure that this potential impact, that excess risk of dying from cancer is as small as possible. And that means getting people seen and treated quickly. Another impact is shown on my next slide. We've been talking to people living with cancer over the last year, and we know it's always a distressing part of someone's life to hear the news that they've got a cancer diagnosis. But that has been even more impacted in the last year. Lots and lots of people with cancer are immunocompromised, so their immune system isn't as strong as it could be. And that means that they might have been advised to shield over the last few months. And that's also taken its emotional toll. So at Macmillan, we try to think about the whole person, and we try to make sure that the services on offer in the NHS and through other healthcare providers are thinking about the emotional needs that people with cancer will have. And we think those have been exacerbated, and we need to make sure that, as we say, when the NHS is getting back on track and cancer services are recovering, we need to make sure that people's emotional needs are met too. So on my next slide, I've got a little bit about what you can do, because I think it's always important to make sure people can take an action away. So as hopefully you'll have understood from my first couple of slides, there is a real impact in people not coming forward and being reluctant to bother their GP. So the NHS all across the country has been running a Help Us Help You campaign, and Macmillan Cancer Support has been supporting that throughout. We absolutely have to encourage the public to get their lumps and bumps and changes and symptoms checked out. And that's why these advertising campaigns, this marketing and all these images you can see on this slide are there. That's really encouraging people to get things checked out. We've also been advocating to decision makers, so whether that's governments or ministers in all parts of the UK, that they've got to make sure that cancer services and cancer staff are really equipped to look after people when they do come forward. And I think that's something that everyone can play their part in. You can encourage loved ones to get symptoms checked out, but you can also take part in campaigns that charities are running. And you can also make sure that if you've got colleagues and staff who might be experiencing a cancer diagnosis, that you're really supportive. Lots of resources are available from Macmillan Cancer Support, including our Macmillan at Work scheme, which is all about supporting employees who might be given a cancer diagnosis. And that means that you get webinars, expert training, and a toolkit that can be a practical resource so that you can support your employees if they're going through cancer diagnosis and treatment. And lastly, I think it's really important just to make sure that as we're thinking about cancer care, and as the country, we hope, gets back to some semblance of normality, that cancer services are equipped to build back better, just as the rest of the country is too. So beyond the workplace and looking after colleagues and friends and family, we really need to make sure that people with cancer get their holistic needs met. And that's why at Macmillan we're championing personalised care. We also need to make sure that cancer services are fit for the future. And that means really supporting the doctors and the nurses and the allied health professionals so that they've got the time and the equipment and expertise and reinforcements, I suppose, to be able to give good cancer care now, but also in the months and years to come, because as I said, it looks like the pandemic has cast a long and devastating shadow across cancer services. So we have to make sure we're going to build back better for cancer care too. So I'm looking forward to hearing the other presentations and taking your questions, and I will hand back to Mark.
Thank you, Sara. That was great, and I think you said early on in your presentation there that a picture speaks 1,000 words. There's no doubt that that was really true. That stat about 356,000 people who'd maybe delayed the opportunity to go and have their symptoms checked is clearly a fairly devastating statistic. And I'm glad you pulled out the emotional impact there, both in terms of people still sitting there worrying, not knowing, and then obviously the pronounced effect of people once they do find out their diagnosis, especially if they've been late to get that. So thank you very much. Great opening for us. So now let's go over to James, who's going to talk to us a bit about what we're seeing at Bupa and how we're responding. So over to you, James.
Mark, hi folks. So before I talk about how we're evolving our cancer services for customers, I thought it'd be useful to give a quick update on our overall pre-auth volumes and trends. So in summary, we're now well out of the Christmas wave of COVID, and hospital services are pretty much back to normal. And we're firmly into what we've been calling the bounce back. So in other words, that's where activity is running above pre-COVID levels as the private sector tackles the backlog in delayed cases that built up over the past 12 months. So I just want to give you a quick sense of that. So pre-auths for new care journeys have been running above pre-COVID levels since early March. And last week we're running above pre-COVID levels by about 20%. So you can see that's a material increase in our normal activity levels. That hasn't yet flown through into pre-auths for ongoing care. So pre-auths for ongoing care have been steadily rising since early February and are now only just below pre-COVID levels. And there's about a 3 to 4 week lag between that new journey starting and customers coming back for treatment. So we'll see where this goes over the next 3 to 4 weeks. But right now, if you combine those two things together, total pre-auth levels are above pre-COVID position. And as I mentioned, we're expecting those to continue to climb over the coming weeks. So that's a really great picture there. So right, let's switch back to today's main topic. So Sara highlighted how COVID has impacted on cancer services, disrupted diagnosis of new cancer patients, and discouraged many people with symptoms from coming forward to access care. For Bupa customers, private cancer services were largely unaffected despite the restrictions in other areas. Overall treatment activity for patients that had cancer at the start of COVID was pretty stable, although we did see change in the way that treatment was being undertaken. In particular, the number of cancer surgeries did fall over the COVID period, and that's particularly in light of the heightened mortality risk from contracting COVID post-surgery. And as a consequence, we saw changes in the way that care was being delivered. So the chemo courses were extended. We saw greater use of trial phase drugs that Bupa funds through our Cancer Promise. So increased use of radiotherapy, so an increase in the number of customers using oral rather than IV medications, so avoiding having to come into hospital, as well as a doubling in the use of at-home chemo services. So it was really great to see Bupa's proposition enable the care for so many patients to be adapted to the challenges that COVID presented over the past year. However, we did also see a big reduction in the number of customers seeking a new cancer diagnosis. This is the graph I'm showing here, a very similar picture to the one Sara showed. And you'll see that pre-auths dropped by about 45% between March and July 2020 versus the prior year, so pre-COVID. And this was despite diagnostic services being largely available in the private sector and lots of messages from us to try and encourage customers to seek help if they had worrying symptoms. Now, thankfully, this position started to reverse in late February. And you can see at that point, the number of new cancer cases entering the system exceeded pre-COVID for the first time. And over the past 4 weeks, you can see that that line just shoot upwards, that red line shoot upwards. And so in cancer, what we've seen over the past 4 weeks is that new referrals are up 30% on pre-COVID levels. So overall, we're expecting about 90% of the delayed cancer cases will eventually present themselves. The balance comprises individuals whose care switched to the NHS during the COVID period, which is a surprising thing that we weren't anticipating, but that we did see that happen. There's also a number of patients whose symptoms would have been benign and have since stopped, but also sadly individuals that will have sadly died during this period. So we think that if the current run rate of new referrals continues, I hope that any delayed Bupa cancer cases will have been diagnosed and be in treatment within roughly the next 4 to 5 months. So that's quite a quick recovery that we're hoping to see in the private sector. So I just want to move on now to some of the changes we've seen in access to care. So as well as changes to treatment approach during COVID, providers also quickly implemented new ways to access services and care, many of these digital. The step change in GP and specialist consultations being provided remotely in the NHS has been really impressive. That said, access to GPs continues to be a challenge for many people. And as Sara was explaining, speed of access in cancer is absolutely paramount to a successful outcome. So for Bupa customers, any member who is concerned about possible cancer symptoms can use our direct access service. And this means they can speak directly with our clinically led team to assess their symptoms without the need for a GP referral. Customers will be referred to a consultant in an average of 6 days and start cancer treatment within 29 days, which is twice as fast as the published national targets of 62 days. And we've also recently launched a Get Treatment section on our websites, and this is to better signpost customers to the direct access service. And it also highlights some of the other services that Bupa provides to support customers during their cancer journey. We're continually working to improve speed of diagnosis and quality of care for customers. I just wanted to highlight a few other examples of these. So in skin cancer, almost all skin cancer patients that are diagnosed at the earliest stage will survive the disease for 5 years or more. And that compares with only 7 out of 10 people surviving when diagnosed at the latest stage of the disease. In June 2020, we launched a new remote skin pathway, and we've seen steady increase in the use of the service since then. The service provides customers with an imaging kit that is posted to their home and uses app technology to share the results with and get a diagnosis from a dermatologist within 24 hours. Since launching, almost 2,000 customers have now used the service, and the feedback we're getting is really, really positive. So moving on to breast cancer. Breast cancer is the most common cancer in the UK and accounts for about 15% of all new cancer cases. When diagnosed at its earliest stage, all people with breast cancer will survive their disease for 5 years or more, but that drops to only 1 in 4 when the disease is diagnosed at the latest stage. In 2019, we established a number of breast cancer specialist centres where someone with symptoms can visit a specialist within 2 days of referral. They can access all the tests they need in one visit and get a same day all clear or initial diagnosis. And if the customer does need treatment, this will start within 31 days from referral, and that's half the published national target. We've been expanding the service since launch, and we now have 11 sites across the UK that are working to these standards. And by the end of the year, we expect to have expanded that to 14 sites. Bowel cancer. Bowel cancer is the 4th most common cancer in the UK and accounts for about 11% of all new cancer cases. Diagnosed at its earliest stage, again, almost all survive for 1 year or more. But that drops to only 2 in 5 people when the disease is diagnosed at the latest stage. So later this year, we'll be launching a number of bowel cancer specialist centres that offer our customers fast access to diagnosis and treatment, whilst using learnings from the breast specialist centres that we've already established. As Sara explained, employers can play a really important role in raising awareness of cancer symptoms, ensuring colleagues are diagnosed as early as possible and supporting customers during their treatment and recovery. If someone is diagnosed with cancer and are covered with Bupa, they should rest assured that we will look after them throughout their cancer journey. It's not just the treatment, we're also here to support patients and their families holistically. Our Live Well with Cancer programme is a holistic care programme led by our oncology nurses. It begins with a holistic needs assessment to understand the patient's needs and concerns across multiple areas, and we then provide tailored support, which could include talking to an oncology nurse, mental health support or counselling for cancer patients. I know Jennie will touch on this shortly, but when businesses are there to support their people with the right level of support and the right type of support, it can make a massive difference to someone's cancer journey. And where possible, patients who want to return to work are supported to do this. We know research that staying productive and retaining a positive mental attitude really helps improve outcomes. I hope this was a helpful overview about the trends that we're seeing at Bupa and how we're here to support our members. Mark, I'm going to hand back to you now.
Thanks, James. And I hope you're starting to see a theme emerging here of calls to action. We heard Sara talk about the need for employers to encourage their members of staff to go and seek treatment, go and get things checked out. And then James has talked about something that we unashamedly go on about, is our direct access service and the fact that people can bypass the need to see a GP and double the pace at which they can actually start that process of getting a diagnosis out and getting well. So please heed those kind of calls to action and join us in trying to accelerate those things. Right, we're going to hear from Jennie now. So Jennie, as a clinician, it would be great to hear from you about how we can support our people experiencing cancer and what changes we may need to think about as we all continue to work differently. And while Jennie's talking, we're going to pop a quick poll on the screen as well, which we'll share the results of a little bit later. So Jennie, over to you.
Thanks, Mark, and hi everyone. It's great to be here today. In my role at Bupa, I work with many organisations to implement tailored health and wellbeing programmes. And over the years, we've seen some great examples of how businesses have supported their people through their cancer journey. As Sara and James have both mentioned, personalised and holistic care is vital, and employers play a crucial role in someone's experience. And this is what I'm going to focus on for the next 5 minutes. The pandemic has positively shifted how organisations prioritise their people's health. In fact, it's fair to say that businesses have never been so proactive in promoting employee wellbeing as they are now. But as the majority of us work in new ways, and with most of us expecting to move to a hybrid working model in the future, we'll need to adapt and evolve the way that we support our people's health and wellbeing. Cancer is life-changing and it affects people's personal and professional lives. Someone with cancer will be dealing with the cancer itself as well as the effects of treatment. As Sara mentioned, they may also be worried about money or overwhelmed by the many important decisions they face. Everybody's experience is different and will require different support. Many patients may not want to continue working or are unable to after a cancer diagnosis. But for others, work can provide some normality, helping to maintain morale, self-identity and self-esteem. So moving forward and looking at people and supporting people who want to continue working. In fact, 85% of patients say it's important for them to continue working, and 60% of people living with cancer who want to stay in work say they value the sense of normality it provides. Helping your employees stay in work or return to work when they feel able can make a big difference to their health and well-being, as well as having benefits for the business too. Looking at how we adapt for our people during their cancer journey. Where cancer is concerned, there are some key considerations for how we support people, especially in our new way of working. Personalised support, firstly. People may experience a range of emotional responses to being diagnosed with cancer and to the treatment that they need. It's important to understand the individual as much as possible so you can tailor the support that you offer them by having sensitive conversations and understanding that somebody's symptoms, feelings and preferences may change over time, but also understanding who else in their life may also be affected by the cancer diagnosis. And this could be children, partners, parents, and signposting the best support for them too. Something to consider would be, as more of these conversations now take place virtually at work, additional line manager training could be considered to help people feel equipped to have the right conversations in the most sensitive way. In turn, looking at new starters, it's important to consider new starters too. The other day I heard of somebody who had joined a new business while they were having cancer treatment, but they only told their manager 6 months into the role because they were worried about how this would be perceived. It was only when they needed to take more time off work for treatment that they explained their situation. The employer was very supportive of this, but they were disappointed that they hadn't been aware of what was happening and able to offer support up until that point. This situation could be even harder to spot in a hybrid working place, and remote working could mean that people miss out on vital support. Creating an open and honest culture where people feel comfortable to discuss aspects of their personal lives will help encourage an environment where people feel safe to share, leading to more people getting the right support for them. And promotion. During the pandemic, we've seen many businesses increase and evolve their health and wellbeing programmes. Given what we know about delays in diagnosis, employers have a real opportunity to encourage people to take part in regular screening and to seek help straight away if they suspect something is wrong. These can be uncomfortable conversations in the workplace, and in the past they have maybe been prompted by something as simple as popping a poster on a toilet door. We now have to think about finding fresh ways to engage and be more proactive about initiating these conversations, either through open conversations or a mix of digital engagement tools. And lastly, looking at flexibility. It's key that people feel that they can take the time for screening or treatment if they need it. And if symptoms are addressed quickly, it may mean less time off work in the long term too. Many of us have learned to work more flexibly over the last year, and we now have the permission to work around our professional and personal priorities. This sense of permission should be encouraged across your workforce when it comes to health and wellbeing, and should be role modelled from the top down, with people clearly giving the message that it's okay to take time for your health when it's needed. I hope this provides some practical considerations that you can take back to your business and clients. As Mark mentioned, we have a range of resources that we'll share with you after the event, and you can always reach out to me or any of the team if you have any further questions. Mark, back to you.
Thank you, Jenny, and a really practical update there. One of the things that struck me, and I think we've seen this throughout all of our Health Insights Live webinars that we've done, is the kind of pronounced role for employers and the need to be even more thoughtful than we would have normally been on some very difficult topics. We saw that with mental health. We saw the role of leaders to take that extra bit of care and attention towards their employees to spot things that are wrong. And I think this topic is no different, and I thought you brought that out really well. Interestingly, the poll results are in. So the question on the poll was, does your business actively encourage employees to attend regular cancer screening checks? It won't surprise you that we got the answer we were probably looking for. Only 30% of people said yes, so 70% of respondents there said that as businesses we're not actively encouraging people to go and get things checked out and have those screening checks done regularly. So clearly, again, more for us all to do. Right, okay, let's go over to Luke now. Welcome, Luke. And Luke, I know you're going to talk about what we're seeing currently in the cancer crisis from your perspective, and also what future innovations we can expect to see.
Yeah, thanks, Mark. Good afternoon, everyone. So we've heard from everyone today about the devastating impact COVID has had on healthcare systems in general, and obviously most important on cancer. So it's important the message we give our population within our businesses, population in general, our employees, our clients, is that healthcare is open for business, and we must get people with those concerns into the system. So as the healthcare systems begin to tackle this backlog, I felt it would be helpful to end on maybe some of the positives that we might see in the future. We've heard one positive of the pandemic is the acceleration of healthcare and digital innovation, which really does create that promise for the future, and perhaps gives us some hope of being able to tackle that backlog. So today I'm going to share some of these innovations that we're seeing specifically in screening, in diagnosis and prognosis. And then I'm just going to briefly touch on the importance of preventative care in reducing our cancer risks, very much as the theme of today, a call to action for everyone and for businesses as well as individuals. As always, this is a pretty high level, quick overview to hopefully leave you curious about the future of cancer services and go away and look into this a bit more. So in terms of innovations in cancer services, if we start with screening, so cancer screening tests look for early signs of cancer in people without symptoms. So they help spot cancers at a really early stage, and in some cases pre-cancerous stage, when the treatment is much more likely to be curative and successful. So liquid biopsies are an interesting area, and these are projected to have a huge impact on healthcare. And this is a test that's performed on a sample of blood that looks for circulating tumour cells or tumour DNA. For cancer screening, there's something called the Gallery liquid biopsy, and that's shown positive trial results in a study using to test for more than 50 types of cancer. And in fact, the NHS is piloting this test with about 165 patients. And really, this could be a really positive development, especially in my view, in those hard to diagnose cancers that often present late, things like pancreatic cancer, where we're often diagnosing at a late stage when the cancer has spread and the outcome therefore is poor. So these show huge promise. Remote screening. So we know the pandemic has led to a significant rise in remote services. We've seen that in Bupa, and I think many of the businesses, healthcare business operating remote services have seen a boom in people accessing these. Now, cancer tests, cancer screening tests are likely to be more routinely performed in the future, perhaps in the comfort of an individual's home as we move forward. And that will help reach more people who may have missed out on routine screening. And a real life on pilot at the moment is the use of home testing HPV kits to check for early warning signs of cervical cancer. And I really think if we can accelerate the ability for people to undergo these kind of tests in an easier, less invasive way, we'll get better uptake. Therefore, we'll really start to impact the numbers of people coming through with later stage cancer. So what's a diagnosis? If a symptom or a screening test results suggests a possible cancer, then it's got to be determined whether it's cancer or it's due to some other cause. And so cancer diagnosis is the first step in kind of cancer management, and the tests used to help diagnose cancer are called diagnostics. So earlier this month, if we think about AI, and I think again, AI has shown a lot of promise, it maybe hasn't delivered quite in the healthcare space what we were hoping, but I do believe it will. It's probably just delayed. A good example of this is earlier this month, the FDA authorised the marketing of the first device that uses artificial intelligence to assist clinicians in detecting lesions in the colon in real time while you're having a colonoscopy. So I think we're really expecting AI to play a much more prominent role in cancer screening and diagnosis in the years to come. There's lots of reports of AI-based diagnosis of brain, breast, lung, skin and other cancers, which claim greater accuracy, faster diagnosis than human specialists. And we obviously need to see what comes out of those reports and those publications to see whether that's actually the case. But we certainly know that earlier diagnosis speeds up the pathway to treatment and potentially leads to downstream late-stage oncology cost savings. It's likely AI will also help to support overworked radiologists who will become more demand on them due to the projected rises in cancer cases. And then remote diagnostics. I've mentioned previously kind of remote testing at home. And we've seen that telehealth has just become more and more important as the pandemic has gone on, and really we expect that to continue. And it can be used for a range of conditions. And aside from tests such as blood, testing from home, saliva, we're seeing now urine and stool test. We won't just move that from the clinical setting into the home. We think other technologies will facilitate this move. And I'll use the example here again, a real life example that's being used at the moment within Bupa is smartphones are becoming increasingly effective tools. And the example here would be dermatoscopes being attached to the phone camera to screen a suspicious looking mole. And that's part of our skin analytics dermatology service that we offer. There's also developments in scanning. So a medical imaging company has just received FDA clearance for an ultrasound-based imaging system, which comes with a probe that connects to an iPhone. So what we're seeing is real innovation in this space, and the cost of these devices coming down so they're more accessible. And then on to prognosis. So once a diagnosis is confirmed, cancer prognosis refers to the likely outcome or course of the disease. And prognostic tools and tests are available to help clinicians estimate this. Again, I mentioned liquid biopsy here. So in addition to screening for cancer, liquid biopsies are also forecast to support in predicting disease recurrence and prognosis. And so recently a liquid biopsy is being developed to identify earliest genetic changes of prostate cancer in blood, a process which could allow doctors to see if cancers have spread. They can monitor the tumour behaviour and monitor the response to treatment, i.e. we can switch a treatment early if we see it's not working, potentially switch off a very expensive treatment early if it's not working. And so there's clearly both benefits to the patient in getting on to the right therapy, but benefits to the healthcare system as a whole from reducing costs. And then we've mentioned polygenic risk scores and genetic prognostic signatures. And I'll just mention one here, which is the Prosigna breast cancer prognostic gene signature, which is a bit of a mouthful, and is an example of a test that analyzes the activity of certain genes in an early stage breast cancer. And that test may eventually be used to help make important treatment decisions. So finally, I'm just going to return back to the theme, just for 1 minute overview of this theme throughout this, of a call to action and positive action we can take. And COVID's highlighted, I think, several uncomfortable truths for the health of the nation. Primary risk factor leading to poor outcomes for people infected with COVID-19 were pre-existing conditions, certain pre-existing conditions like hypertension and diabetes, and an unhealthy lifestyle, obesity. So as a result of a pandemic, I think it is showing promise that perhaps the UK might now actually start to take preventative health and public health much more seriously. So whilst all of what I talked about before, especially the early detection of cancer, is crucial, we must also consider that 4 in 10 cases of cancer in the UK can be prevented. And that data and stat is from cancer research. Now, the following may seem really obvious, but they're a stark reminder of the actions we can all take to reduce our cancer risk. So smoking, biggest cause of cancer around the world. Obesity, second biggest cause of cancer. We don't hear that talked about yet, possibly from the impact that obesity has had on COVID mortality. Hopefully that will gain more traction, and we will talk about the impact obesity is having on the health of the nation, especially around cancer. Obviously, exposure to too much ultraviolet radiation, we know leads to the main cause of skin cancer. We know that having a healthier diet could prevent around 1 in 20 cancers. Alcohol, can cause 7 types of cancer. This is about moderation. It's about eating healthily, drinking moderate amounts of alcohol. But alcohol is linked to breast, mouth, and bowel cancers. And this keeping active, helping you lose weight or keep a healthy weight, can help reduce the risk of around 13 different types of cancer. So as I said, COVID-19 has really brought some uncomfortable truths to home, I think, for the UK. Recent study found Britain has the worst life expectancy in Europe. And that finding was driven again by those conditions I talked about earlier: obesity, high blood pressure, chronic respiratory conditions, excess alcohol. And so I think COVID-19 has exposed the lack of action on prevention and population health improvement in the UK over the last few years. I think it would be a mistake to think that the solution to future pandemics lies in better vaccines, more hospitals, a sprint to develop treatments. We need to prevent illnesses, both the communicable, as we've seen with COVID-19, and the non-communicable ones. So I think it's clear, finishing on a positive note, COVID could certainly drive a new strategy for a healthier Britain, where we've got, I suppose, 4 key partners, so localities, the NHS, the private sector, and innovators, all coming together to really improve the health of the nation overall. As Jennie mentioned earlier, one positive last year is the increased focus on people's health and well-being in the workplace, and all of us within organisations, all the leaders, as Jennie mentioned, from the top down, have to lead on this and make it a serious bordering priority. So COVID-19 perhaps provided a chance for a new national health mission around preventative care and absolutely the impact that this can have on cancer diagnosis into the future. So I hope that was useful. I'm going to pass back to Mark and stay around for questions. Thanks, Mark.
Thanks, Luke. A great update as ever, and thanks for all that insight into some of the technology-driven things we can expect to see, and some of them that are clearly already happening. So we're going to go into Q&A now. As ever, we've had lots of questions coming through, and whilst we ask the questions of the panel and get you some answers, we will pop another poll onto the screen. So if you see that come up, please take the time to answer the poll, and we'll share the results of that before we finish today. But the first question I'd like to ask is for Jennie. So Jennie, just if you're ready there you go, see you coming off mute. Jennie, we showed that poll earlier, which didn't look great in terms of the role that employers are playing in terms of encouraging people to have regular screening checks. What do you think's behind that? Why are employers, or why do we think employees are reluctant to go for regular screening checks, and what can employers do about that?
Yeah, recently this came up when I was chatting with one of our financial services clients. One of their ladies had found a breast lump during the first lockdown. The lady said her initial thoughts were to ignore it, hope it might go away. She had a week of back-to-back meetings, and she was worried about putting her family at increased risk of COVID, or taking up frontline healthcare workers' time unnecessarily. Fortunately, she attended a health awareness programme organised by her employer, which helped her to understand the warning signs of cancer and how to get help through the company's medical scheme as well. She'd learned through the programme that her cover included direct access, so she didn't need a G referral. And within 10 minutes of speaking to our trained advisor at Bupa, she was booked in for a consultation at her local hospital. Within less than 24 hours of finding the lump, she'd had the tests and was thankfully given the all clear.
Great, thank you, Jennie. And one of the things that struck me, actually, I saw a LinkedIn post just the other day. It wasn't to do with cancer, but someone who'd had a heart attack. And they said that as they were experiencing the symptoms of the heart attack, the first thought that went through their head was, this is really inconvenient. I've got a bucket load of meetings tomorrow, and how on earth am I going to hit the deadlines? And I think, again, COVID, with this merger of home and work and people working long hours and heavy demands on people, it does kind of really raise some bigger questions for how we create space for people, and how we have a moral and business responsibility to make sure people don't have those kind of thoughts when they think something's wrong with them. Okay, next question, Luke. Obviously, miracles have been performed with the COVID vaccine and the rollout. The pace at which we've gone there, do you think there's any learning there, or anything we can take specifically with the COVID vaccine that could help us accelerate treatment for cancer?
Yes, I think there's probably 2 or 3 comments on this, really. So I think first of all, to say the amount of money that we've thrown at the vaccine program has been huge. You know, I can't even imagine that amount of money being found and thrown at cancer, but you can imagine, if you did, what kind of advances you can make. So, but I think there's some specific areas, you know, the scientific advances with the COVID vaccines, and the MHRA in this country's rapid approval, as well as, you know, the FDA as well, rapidly approving the vaccines, enabling their swift rollout. You know, you could take a similar model to accelerate approval of other new drugs, including cancer treatments that may be, you know, stuck in a longer approval process. Now, clearly there's risks with that, but I think everybody's clear that the regulatory authorities, the MHRA, have done a good job with the appraisal of the COVID vaccine. So I think that's an important thing to speed up the progress. And I think the second thing is around the science underlying some of the COVID vaccines. So that could be used to create new you know, interventions for other diseases such as cancer. And certainly the developers of you know, the Oxford AstraZeneca vaccine have founded a new biotech company on the back of that, using some of their technology to develop new cancer therapies. And there is a trial of a new treatment for non-small cell lung cancer beginning soon. And then I think finally we may be able to repurpose existing drugs that are being used in other areas into cancer treatment. So, and again, we've seen that a reverse way in the use of something called Actemra in COVID-19 to prevent some of the more severe consequences of being infected by the coronavirus. So I think it shows real hope for the future, but will cost money, a lot of it.
Yeah, I guess as ever on every topic, COVID's kind of pushed boundaries in lots of different ways and reshaped the way we need to look at things. Okay, next question is for, I'll come to Sara first, actually. So Sara, someone's message saying that they've observed real difficulty in getting appointments with GPs. A good example here is even when ringing up and telling the receptionist that someone had a lump on their breast, there was still a 2-week plus wait for even a telephone appointment. What do you think people can do in the NHS to kind of get around that and find ways of giving themselves peace of mind more quickly?
No, and it's a great question. I don't think, sadly, this is uncommon. We've heard from people with cancer and members of the public that they're really noticing a difference in what's happening in primary care. And I wouldn't be I wouldn't want to do down the huge efforts of GPs and primary care, because they are obviously incredibly busy also rolling out the COVID vaccine programme. And talking to GP colleagues, I know that they've said, please be persistent, and also that they are working differently. So a telephone appointment might not feel very satisfying if you're worried about something physical and you want to get that examined, but it might be the best thing for the person to have that first telephone appointment and then get referred on for those physical checks. So I suppose it's a case of, I've heard from GPs, they're sort of saying, yes, we really do want people to come forward. It might be frustrating, but that telephone appointment might be the best thing to do. And patients should also feel empowered and happy to sort of raise their voice and complain. We have a Know Your Rights toolkit on our campaigning web pages that show what people should expect if they're using the NHS to get symptoms checked out. But it's important not to let it discourage people too much, even if it's been a bit tricky to get that first appointment with the GP and then get referred on.
Great, thank you. And Luke, I don't know if there's anything you'd add from a Bupa perspective.
Yeah, I think just to reiterate from NHS perspective, it's incredibly patchy. You know, I'm a GP by background and still linked into a lot of that. It's the variation really. I think you've got some practices that are, you know, seeing patients and providing really good access, and then others that are just overwhelmed at the moment. So persistence, I think, is really key. I would say from a Bupa perspective, you know, we've got our Cancer Direct Access service, and that is really a phenomenal service where you don't need a GP referral. If you've got a symptom that you worry could be cancer, you can phone our specialised team, and they will direct you and pre-authorise you for a consultant appointment specialist within that area if you meet the NICE criteria for referral. And so I'd really encourage, you know, for a Bupa member to use that first port of call. If you don't have Bupa and you're within the NHS, then persistence is key, really.
Great, thanks, Luke. James, you obviously showed a lot of data about how we're seeing pre-auth volumes coming back and sharply. I guess that's great news from the perspective that it means people aren't kind of sitting there and just leaving it. They're now getting in touch with us, which is fantastic. But I also think maybe the audience will be thinking about the ongoing future cost should that line continue going up, whether it's our intermediaries or our clients on the phone. What have you got any view, crystal ball time on whether you think that line just keeps going up, or does it flatten off, or does it drop down? When might that happen? Any perspective if I put you on the spot with that one?
It is quite a crystal ball, Mark. So our central assumption is that overall activity levels will reach kind of 10% above pre-COVID levels and run at that position until around about September time, and then gradually reduce, but with some kind of additional activity flowing into 2022. Now, part of the assumption behind that is around the level of additional NHS work that the private hospitals take on to help deal with the NHS backlogs. And from what we're seeing, that's being slower to mobilise than we had originally estimated. So that might mean that hump is kind of compressed a bit. So it might be taller, but shorter. So but it's still really difficult to say. So I think, you know, we'll know what the peak of that hump looks like in a couple of months, and then it'll take a few more months to know whether it's going to drop off as we expected.
Great, thank you. Good attempt at answering a crystal ball question. I think it's a bit similar to what we saw this time last year, where we were trying to make predictions about what would happen. One of the things that this webinar gives us the opportunity to do is to keep sharing with people what we're seeing emerging. So I think the audience can expect to see us share the evolving picture each time we get together. So that would be great. And James, while I've got you there primed and off mute, one of the questions that's been asked in the chat there is that we've talked a lot about the digital tools and some of the innovation that we've brought, and we've told a very positive story about usage, but what things do you think have got in the way around patient uptake or access? You know, are there things that we still need to overcome in terms of driving more pervasive use of those?
I think the biggest is awareness, actually, customer awareness. And just to put that in context, so the MSK direct access service, where you get a remote assessment from the physio, that's been running for I don't know, maybe 6 years now, and that's our most popular remote service route, and about 25% of customers that are accessing care for an MSK complaint go down that route. All right, so after 6 years, we've grown that to 25%. The other services get much lower take up, mainly because of, I think, customer awareness, and that's something we're actively trying to change. I mentioned the get treatment pages that we've launched on the website. And that's a first attempt at trying to bring together all the different access routes that customers have to better signpost them to the most appropriate one. And you know, we're taking that, continue to build on that. So particularly in Bupa Touch. So this is the customer kind of servicing platform that we're rolling out at the moment. And you know, we have this concept of a virtual health centre that we're building in there that intends to guide people into the right start point for their care services. So I think that's a big step change, going to be a big step change for us in improving awareness, Mark.
Brilliant. Thank you, James. And I'm very conscious it's 58 minutes past the hour, and there are still quite a few more questions, but fortunately for the panel, it looks like I'm not going to have the opportunity to put them right on the spot, but we will come back with answers for people. I wanted just to quickly share the results of the second question that we put out. Do you think your business could do more to promote preventative healthcare? Again, it won't surprise you to see that the answer was 94% of people said yes. So I think, you know, to close off today, I think if there's one thing that certainly I've taken from the session, more than anything, it's a call to action for us as an industry, a call to action for us as employers, leaders, colleagues, friends, family members, to really keep promoting the fact that it's really important that people go and seek treatment as fast as possible the minute you think something could be up, and that we provide that support and encouragement and the space and the safe space for people to do that. There's no doubt that speed is absolutely of the essence on this topic. It helps us from a business perspective in terms of costs, but more importantly, there's a huge human cost at stake here. So I hope you'll join us post today in sharing the word and getting that message out there. Please get in touch if you'd like any help in doing that with materials or messages or any clarification of anything we've talked about today. We will follow up as ever with the next edition of our Health Insights email bulletin, where we'll be touching again on cancer. And we'll be back again on the 24th of June with our next event. So thank you for joining today. Spread the word, and until next time, please stay safe and well. See you soon.